Hi, good afternoon. My name is Andrew Acevedo. I'm going to be facilitating you through tactical emergency casualty care. I'm part of George Washington University's EHS 3105 class. So we're going to be going through some breathing and preventing hypothermia. At this point, you've already seen a video about airway, and more than likely there's going to be some kind of OPA or some kind of device that has been placed on the patient to make sure that their airway is patent. So this point, you're going to make sure that the patient is still breathing in and out. Okay, so you can take something like a stethoscope. You're going to listen essentially to the lungs, and you're going to try to look to see if you can hear air coming in and out. If for some reason there is absence of sound, or you hear some kind of like gurgling sounds, more than likely that's probably fluids or air that is currently taking over the lung. So when that happens, then you have to start considering things like tension pneumothorax or a pneumothorax. So when you do a sweep, you're going to look to see if any blood, right? And you're going to look to the back. If someone's here, they're going to hold the head so that you can check the posterior side for any holes, stabbing, gunshot wounds, anything like that. If you see a hole, plug it immediately. Then you're going to try to see if you can put a commercialized occlusive dressing such as this one. Usually what happens is the occlusive dressing is going to have tape on it so that it pretty much just goes in and a vent so that air and fluids can escape. Sometimes you might not be able to have that, so you can fashion one out of cardboard or a credit card or something, kind of put tape on 3 sides, allow that corner piece to be able to push out any air or fluids as well. So if you see that it's for some reason building up, the fluid or the air, you're going to see a couple of signs, something called jugular vein distension, which the side veins over here are going to kind of look like they're popping out excessively, or you're going to see the trachea deviating to the good side. When that happens, when the buildup is happening on, let's say, on the right side, it's going to push the other side, the lung. Essentially, the unaffected side is going to be kind of being pressured into a corner, and then you're going to see the trachea moving towards that good side. So at that point, you need to kind of intervene. So you have to provide some kind of relief for the side that's building up. So since you can't do the needle decompression because you have to be trained, you can do something that's called burping. So essentially what you're going to do is you're going to push down on the area, obviously, to try to see if you can expel any of that air or any of that fluid. Obviously continue to monitor, make sure that the airflow is going in and out. Again, stethoscope is going to be your lifesaver for that. Now let's go into hypothermia. So when a person is in shock, they're going to be showing some signs of shock, mainly bluing around the mouth, bluing underneath the mucous membrane. So if you lift down the eyelid, you can see kind of bluing in that area, and then also in the fingernails. So you want to keep that patient warm. So if you're somewhere like where there's metal and things like that, it's very cold, so you want to move them to somewhere where they're going to be warm. You can use things like sleeping bags, you can use clothes, anything that's going to keep that patient warm. If they're wet, try to remove the wet clothing and then try to cover them with something dry and warm, like a commercialized blanket. Some companies have commercialized heating blankets to keep the patient warm, and then just keep monitoring for your patient. So follow the next video and then you'll see some more information.